the reporting wasn't done in a timely manner, and so those cases were added. And in some situations, the reports weren't filled in completely. And so what they did is they did a review of that, and they revised their numbers, and those were the numbers that were updated overnight. It is very important to know the numbers of people who have died from COVID-19, because this is of public health importance. And it is important that we have the accurate reporting of this. And in such, WHO has developed some guidance around this, which is for the international guidelines for certification and classification of COVID-19 as a cause of death. And this is based on ICD codes that exist. And our primary goal is to support countries in their ability to classify people who have died from COVID-19. And I just want to say that this is something that is a challenge in an ongoing outbreak, to identify all of your cases and to identify all of the deaths as an outbreak happens, especially if systems are overwhelmed. I would anticipate that many countries are going to be in a similar situation where they will have to go back and review records and look to see, did we capture all of them? I've seen a number of reports from media where people have been in a number of different countries where people have died outside of the hospital system. And so it will take some time for those individuals to be classified. So it is important that cases that do die from COVID-19 are recorded, and we've provided some guidance to support countries to do so.
Thank you, Marie. And thank you for the clarifications there, but we would also like countries to be as fast as possible in that process. I know that it's somewhat forensic to go through these processes and everyone wants to be sure, but it's really important that we understand the size and scale of the pandemic as it moves forward. And the use of a probable case definition or others where you can, in a sense, say, yes, this was probably a COVID-19 case is better. I would commend the authorities in New York, for example, who announced a list of, or a number of probable deaths, which gives a much better sense of the impact of the epidemic. And it's that kind of speed with doing that. Those numbers may change over time, but I think it's always better when people put forward the data that they have as early as possible, because that keeps us on top of what the impact is and allows us to project forward in a much more accurate way. So I think, as Maria said, all countries will face this, but I do think, you know, it's important that countries provide that data as quickly as they can in the interests of moving our collective efforts forward to control this pandemic.
Thank you very much on this. Next question is Gabriela Sotomayor, our friend from Geneva-based press corps. Gabriela, please go ahead.
Thank you very much, Stein. Thank you for giving me the question. It's very nice to see you all. And I have a question. I